Now, in terms of the research, I guess my research, again, going back to that, is how can we take what we already know is effective and make it applicable to people in the rural population. We often talk about that typically new devices, new techniques in health take 15 to 20 years before they move from the academic center out to particularly the rural setting. And that just seems like that's way too long, and we ought to be able to move that more quickly, or to be able to bring opportunities to people who are in those areas. So my research then is looking at different techniques or applying different techniques to different communities to see how that can be, those techniques, screenings, can be adopted more quickly in certain areas.
Do you notice any shortening in that lag for prevention versus intervention? I mean, does that make, am I making myself clear? In the sense of, say, an intervention, if we discovered a technique and we have to go through approval, federal approvals, et cetera, and so by the time that washes out to the provider in the rural area, 15 years, versus if we come up with a best practice for spreading information, getting people engaged, willing to come into providers before they feel sick. Do you notice, is there any sort of shortening of that time frame, or is it still, do you still struggle with that?
Oh, I think we still struggle with the time frame, and but I think that there are some positive steps in some of the research. So, for example, we have been investigating going to bring women into mammography to detect breast cancer by going to where the women are. And we've particularly been exploring the issue of working with food pantries or food banks, food kitchen sorts of efforts. That's where we feel that there may be people who haven't seen a physician recently, may not have insurance, and that's a place where we have an opportunity to make an impact upon their lives. So what we're looking at is, can we develop methods and techniques that will engage that particular population to take advantage of resources and healthcare that are already in the community. Now, do we know what's the most effective? So our research is then trying to understand what's the most effective way to engage those people, those healthcare providers, those hospitals in the delivery of that service. And so we're often trying to look at what are comparisons. So in Pennsylvania, for example, we're doing a study there where we are engaged with 4 different communities, and each of them is approaching their food pantries in a little bit different setting, a little bit different situation, and then we're going to be able to look at the outcomes and look at their processes and maybe make some statements about what might be the best approach for engaging that kind of people.
When I reflect back on my youth growing up in rural areas, and I think that the church social, you know, it would be an ideal opportunity where you can reach families, where you can reach women. Are there any history with that, or?
Oh, yes. Yeah, there's, in this effort, in this country, we're fortunate to build on a pretty solid foundation in a church or faith-based approach to health education, health promotion. A large part of the work has been done in the African American churches, particularly in the Carolinas, in some of the in some other areas as well. In Pennsylvania, we're beginning to look at that avenue as well. Also in West Virginia, I know they've done some research in looking at that approach as well. But the church is an opportunity for reaching a number of people. It's where people do congregate, particularly from the rural community. Often there is a message that goes along with that then as well that the people can embrace, and it's a natural setting. So, for example, we are very active in our cancer education program now in faith-based settings in Pennsylvania.
Great. One last question for you.
Okay.
And that is, are there any stories? I mean, this sounds like fascinating work. Are there any stories that stick out for you from doing this outreach in rural areas, or the difference that the prevention might have made that bubble up for you now?
Oh, gee. I could tell you 2 stories. One is coming out of our research, and one, as I said, I was describing that taking recruitment to mammography for low-income women to the food pantries. We were engaged with one county in doing that, and there were 3 cancers that were diagnosed through our process which probably would not have been diagnosed otherwise. And so those are 3 women that had a diagnosis earlier probably than what they would have received it. So that's very heartening to me, and that's something that we as researchers are excited about showing. And then sort of on the other side, also we were some folks who live in Canada happened to be in Pennsylvania, and they had a grandmother who had breast cancer, and they were interested in giving some money to breast cancer research in Pennsylvania, and particularly in sort of the rural area, because that's where the grandmother lived. And somehow they found us sort of on the web and said, we hear you do good work about cancer prevention and control research in our area, and we'd like to donate a little bit of money to you. So it was not that we got the money out of it, but here was the fact that our efforts had been recognized through a network, sort of a social network that reached not only in Pennsylvania, but then also off into Canada, and that was pretty rewarding then as well.
You know, that's interesting. We had an individual come to us with a very similar story. He said he and his mother lived in a rural area, and he heard about the work that we were doing and said that she had survived breast cancer and wanted to make sure that what allowed her to survive it, that those resources were moved forward, and came to us with a similar offer. So it's nice to hear.
Yeah, you know, I think typically when we think of cancer research and the dollars that are needed for it, we typically think, I think it's common for people to talk about laboratory-based and clinical-based, but I think there's a significant amount of research that can take place to bring some of the new or even techniques that we already know about to people in an organized, evidence-based approach more quickly.
Yeah, and it sounds like breast cancer is one of those diseases which has more traction around the kitchen table, perhaps, than just the laboratory or just the clinician's office.
Well, I think we have a long history to build upon. Organizations like Susan G. Komen Research, the American Cancer Society, a number of organizations have really laid a lot of groundwork and awareness raising in that area.
Well, any last advice for anyone in a rural community now who does not have cancer, but a chance to do some outreach?
Well, I guess sort of a couple of pieces. One is, as I said before, get more associated with your healthcare system in the community and partner up with them. And then I think also to realize that that you may actually be able to contribute to a research initiative that would help improve cancer prevention and control in the rural area as well. That you don't have to think about it just as happening in a far off setting, in a laboratory or in a hospital bed.
Great. Well, thank you for taking the time to be on this, and we are going to put links to both Dr. Lengerich's work and the Carbone Cancer Center for more information, and you can always find us at the Office of Rural Health's website. Thanks.